Hey guys, hope everyone's doing well. My assignment is why radiation safety education should be required for all medical staff. So, imagine going to the hospital for a routine exam and being exposed to unnecessary radiation simply because a staff member was not properly trained in radiation safety. So, medical imaging saves millions of lives every year, but it also involves ionizing radiation that must be used very carefully. So, radiologic technologists spend years learning how to safely produce diagnostic images while minimizing radiation exposure to themselves and the patients, of course. So, however, many other healthcare workers interact with imaging equipment or patients who are undergoing imaging procedures without having the same level of radiation education. So, today, I will argue that radiation safety education should be required for all medical staff because it protects patients, it improves healthcare teamwork, and reduces long-term health risks. So my main point is protecting patients from unnecessary radiation. So, firstly, radiation safety education is critical for protecting patients. They say that modern imaging technology is already very safe, which I somewhat agree with, but it does not mean radiation cannot still be harmful when used incorrectly. So, according to the World Health Organization, ionizing radiation can increase the risk of cancer if exposure accumulates unnecessarily over time. So, without proper training, medical staff may request imaging exams that are not needed or repeat scans that could have been avoided. So this actually, I have a good example of this at my summer site at ECMC. The ortho residents would order many exams that were not needed. So this, again, causes unnecessary radiation, and it's not good for the patients. So I added this, but for example, ordering duplicate x-rays or CT scans without checking previous imaging records, this exposes patients to X-ray radiation, which there's no medical benefit for this. And another thing is teaching healthcare workers the principle of ALARA, which means as low as reasonably achievable. So this encourages minimizing radiation exposure while still obtaining necessary diagnostic images. So if all healthcare professionals understood this principle, patient exposure could be reduced significantly. So my next point is improving communication and teamwork in healthcare. So a second reason here is radiation safety education should be required is that it improves communication between healthcare professionals. They say that radiation safety is mainly the responsibility of the rad tech and the radiologist. However, the imaging procedures involve a team that includes physicians, nurses, and emergency staff. So according to the American Society of Rad Techs, the effective radiation safety depends on collaboration between all healthcare workers involved in imaging procedures. So for example, nurses may assist patients before imaging, physicians order the imaging exams, and techs perform the scans. So if only one part of the team understands radiation safety, mistakes and misunderstandings can occur. But by educating all medical staff about radiation risks and safety procedures, healthcare teams can communicate more effectively and make better decisions for the actual patient. So my third, and I feel like it's a pretty important reason, is this also reduces the long-term health risks for staff. So radiation safety education is important for protecting healthcare workers themselves. So medical professionals who work near imaging equipment can be exposed to small amounts of radiation over time. And according to the Centers for Disease Control and Prevention, repeated exposure to ionizing radiation can increase the risk of long-term health effects if safety procedures are not followed correctly. So rad techs are trained to use protective equipment like lead aprons, protective shielding barriers like the walls in the x-ray rooms itself, and distance techniques to reduce exposure. However, other medical staff who assist during imaging procedures may not always receive the same level of training. So, providing radiation safety education for all staff ensures that everyone understands how to protect themselves and how to protect others when, working with or around radiation. So my conclusion is, in modern medicine, medical imaging plays a vital role in diagnosing imaging injuries, and detecting diseases. Also guiding treatment. However, with the benefits of imaging also comes the responsibility. You're working with ionizing radiation, and radiation safety education should be required for all medical staff because it protects patients from unnecessary exposure, and it improves communication among healthcare teams and reduces long-term health risks for the workers themselves. So if I were a nurse, I would want everyone around me and myself to understand the risks and all that to do with ionizing radiation. So by ensuring that every healthcare professional understands basic radiation safety principles, hospitals can create safer environments for both patients and staff. So medical imaging saves lives every day, but only when it is used responsibly and with proper knowledge. So the sources that I used were the American Society of Radiologic Technologists, the Centers for Disease Control and Prevention, World Health Organization, the National Council on Radiation Protection, and the International Atomic Energy Agency. So that is my project. Hope everyone has a good break. Bye.